Today we are going to be talking about the removal of a pigtail drainage catheter. These catheters can be used for chest tubes, nephrostomies, biliary drainage, many different things. So know what drain it is that you are removing. The first thing I want to show you guys is the reason we call it a pigtail. So I'm going to kind of show you what it might look like on the inside of your patient. If you'll notice right here, it looks a little bit like a pigtail, hence why we call it a pigtail drainage catheter. Okay, and so what we have to do in order to remove this catheter is to release the suture, the internal suture that holds that tube in place, so that it's released and we can safely remove it from our patient. So the first thing we're going to do is we're going to gather our supplies. You are going to need a suture removal tray, some gauze. Depending on what kind of catheter it is, you might need a petroleum dressing, such as if it's been used for a chest tube. Then you will need a transparent film dressing or tape, some scissors, and then of course gloves. So the first thing we're going to do is we're going to put on our clean gloves and remove our dressing from the catheter. Make sure you hold the catheter down when you remove that dressing so you don't accidentally tug on it. Okay. If there are any sutures at the site of the drain, any extra anchoring sutures, make sure that you clip those. And your suture removal tray, you've got your tweezers and your scissors, or you can do that. Then you're going to grab your scissors. You can either use those scissors from the tray or your medical scissors. I like to use these. They cut it a little bit easier. We're gonna hold firmly to the catheter right here so that it doesn't create, whenever you cut it, it doesn't create that negative pressure and pull it inwards. And we're gonna clip at least 2 inches away from the exit site to release that internal suture, AKA pigtail. Okay, so we're gonna cut right about here. Okay, so I'm gonna grab my pigtail and I'm gonna cut that catheter. Okay, I'm going to move our back to the side. Then it will release this pigtail, as you can see, and we can safely remove it from our patient. Okay. Once you remove it, you can get your gauze, put it over the puncture site. Okay. And then again, remember, depending on where it came from, we can use the petroleum dressing or gauze if it's a chest tube. And then we can get our transparent film, or you can just grab some tape, depending on if it's got some drainage from the site or not. I should have opened this tape. And make sure and tape it down. On all sides. It's not very good tape, but it's okay. You can tape it on all 4 sides, or just like this, depending on how big your puncture site is.